And action.
Welcome back to Skin Deep Sessions. This is our weekly opportunity where we get together to discuss any hot topics in regards to skincare, aesthetics, any questions you might have, anything that's going on in the media. And today we are going to be focusing on Profhilo and talking a little bit about the difference between the original Profhilo and the newer Structura. So I'm Sarah, I'm the aesthetic nurse at Skin Deep, and I'll let the others introduce themselves.
I'm Vanessa, I'm the co-founder of Skin Deep.
And I'm Zoe, and I'm a senior therapist here at Skin Deep.
Fab. So we're going to talk a little bit about Profhilo. We have posted quite a bit about this on our socials, and we've got quite a lot of questions that have come up as a result of those posts. So we'll go through a few of them, I think.
Mm-hmm. Do you want to tell us a little bit about Profhilo to begin with?
Yeah, so Profhilo is different to anti-wrinkle treatments and fillers, so your Botox and fillers is completely different to that. So it's in the skin booster category. But what makes Profhilo different is that it's patented. So it's not like any other skin booster on the market. It's a biostimulator, it's a regenerative treatment, and it basically is working from the inside out. So it's giving your skin everything that it needs, straight to the point, and it's helping to promote your natural collagen, your natural elastin, but it's not a specific targeted treatment, as in, so if somebody came to me and said, I really don't like, my nasolabial folds, or I don't like, my marionette lines, it's not a targeted, it's not a targeted treatment for. So
just to clarify there, it doesn't change the shape of your face at all.
No, it doesn't change the shape of your face. It's not adding, like fillers will add volume to your face and change the contours of your face, and you can be quite specific in those areas with filler. This is more of an overall improvement to your skin. So
I always feel that I have Profhilo and I've had Structura, so I've had both of them, but I always feel when I have it, and I often say this to my clients as well, they're like, oh, what is it, what does it do? And the way I always describe it is really simple. I feel like it's an injection of sunshine going into my skin.
That's a good description, actually.
That's what I feel like it is. It's like a glow that goes in, and I just feel like I describe it's like it goes in, and then it's like honey. It just moves around, and then it's like sunshine. Your skin glows after it.
Yeah. So it does kind of spread under the skin like a honey. So it's it works from the cheekbones down. So if you imagine kind of the mid and lower third of your face, then you're going to get a great overall improvement in those areas.
So would you say then, obviously I've had both, and I've liked both for different reasons. So why would you differentiate one from the other? Why would you say, well, yeah, you need Profhilo, whereas you'd be better off having Structura? What?
So the original Profhilo is generally great for everybody. So you're pretty much anyone, especially anyone over the age of 30, is going to see an improvement in their skin from using the original Profhilo. But what it does is it works on the superficial layers of the skin. So it's very superficial injections, and it will help with kind of that, if you're feeling like your skin's tired, dull, gives you that overall brightening. It will help with some fine lines and just giving that kind of little bit of a plumping effect, and but more from a hydration perspective rather than adding volume to the face. So just that, the original one would be great for anybody kind of over 30, whereas the Structura is better for people who are starting to notice volume loss. So
my age category, perhaps, where I'm starting feel like I am losing loss.
So we're losing volume from our 30s. So 30s, 40s, 50s, but everyone ages differently, don't they? It's a different process. So it's great for the way that it's different is that it's injected into the superficial fat in the face. So we have some fat pads in this area here of our face. So it's injected into this area only. And as a result of that, you kind of see an improvement in some jowling in the lower face. Some people have reported seeing improvements in the under eye as well. So it's kind of restoring some restoring some of that lost volume, but in a regenerative way. So not by adding a filler, by promoting your own natural collagen, elastin, and just biostimulating from the inside out.
And would you say that's the case for, because obviously we have in the clinic a lot of male clients as well, and male clients for the Profilos or Structura. Is it the same for them? The same, you know, doesn't differentiate. So
No.
The same for the men as well.
Yeah, exactly the same for the men. I've got a few male clients that are having both treatments. So both of them go side by side really. So although when you initially have the treatment, one may be more suitable for you than the other at that time, but for some people you may benefit from having both, and you can alternate those treatments, you know, and have both side by side really.
And how often would you recommend people have this treatment?
So initially, if it's your first time having the treatment, it's recommended to have 2 treatments within the first 4 to 6 weeks, and then after that you can have a top-up then every 4 to 6 months, just one treatment every 4 to 6 months, just to keep on top of it. Some people don't feel the need to do that, and if they don't, they may leave it a year and then do the 2 treatments again the following year. But you know, ideally you want to be keeping it nice and topped up. So
and could you then, I obviously come to you every 6 months, could I mix and match, or am I better off sticking to, so let's just say now I've had my 2 treatments of one or the other, in 6 months time, is it best to stick to what I've had, or do we wait until the 6 months and then you might advise me, well actually you might need this one this time?
Yeah, I think it depends on your areas of concern really. If the areas of concern have improved and you're happy as they are at that point, then we could alternate it and try a different one and try and get even more of an improvement by using the two together. But if we're still working on the initial concern that I recommended the one of them for, then I would recommend sticking with that one for now.
You wouldn't recommend it for someone sort of younger than 30 then?
Not the Structura. It's unlikely that anyone younger than 30 would really need the Structura treatment, but definitely, you know, the original Profhilo, that's going to be great for anybody. But I'd say you'd get more benefit from it kind of 30 onwards.
Yeah.
So on the market at the moment, obviously skin boosters is a big word, isn't it? You know, here at the clinic we always, you know, everything we do is branded. Why is that important with Profhilo then? You know, why Profhilo against any other skin boosters?
Like I said at the start, because this is a patented product, there's nothing like it on the market. So despite other brands maybe claiming to be like Profhilo, there is nothing like it because they can't be like it. But the other important thing is that with Profhilo, it's so important to go to a registered professional to get your treatments done, because there is so many counterfeit products on the market. And with what Profhilo have actually started doing now is they've added some holograms onto the boxes of the product, so you know exactly where that's come from and you can trace it back, because Profhilo itself only sell their products to licensed pharmacies, and those pharmacies will only sell the products to medical professionals. So if you're getting your Profhilo from someone that's not a medical professional, where are they getting it from?
Yeah,
you know,
would they have a prescriber maybe?
No, so Profhilo doesn't have to be prescribed because it's a skin booster, but you would have to get it from a pharmacy that's been, you know, that IBSA, the people who make Profhilo, are providing it to, and they only sell it to medical professionals. So you need to make sure that if you know where you're going, you're able to trace that product back, and that it's got that hologram on it, and you know that it's a genuine product.
Yeah, because I mean, there's nothing worse than counterfeit products either, is there? You know, there's a lot of talk about that at the moment. Not just with, you know, Profhilo, but with a lot of things, isn't there? Yeah. Okay, so because we've kind of done quite a bit in our social media and things, there's been quite a few questions. So myself and Zoe are going to ask you some of the questions that have come up on social media, and maybe we can cover some of those. We'll take it in turns. Have you got yours up there?
Yeah, I'll start here. Let's have a little look. We've covered a couple of these already. Someone has been asking about swelling after the session.
So After your treatments, it depends obviously which one you have. The original Profhilo, you are left with some little bumps after the treatment. So, you know, you guys have had it, you know, well, you haven't, you've had it, but you know that they kind of look almost like a little bee sting, you know, like just a small red lump, but it goes down within about 12 hours or so. It's just where the product's been deposited, and then it will disperse under the skin. So, you know, it's not anything that would prevent you from carrying on with your day-to-day activities, you know. But yeah, so you are not kind of overall swelling, but just small little bumps that were at the injection site. With the Structura, that's injected with a cannula, so you're left with more of a line after that product rather than the little bumps, but the same principle applies. It does disperse over the following 12, 24 hours. Some people take longer than others. Some older skin can take a little bit longer for it to disperse, but you know, don't panic. It can take a couple of days, and that's absolutely normal.
I think when I've had mine, to be fair, yeah, I have the lumps when I leave the clinic, but the next day nobody would be, I can slightly feel it, but the next day nobody really notices.
Yeah.
But with a structure, I quite like that anyway. Cause
it kind of gives you a nice tight feeling, which is quite nice.
It is. How many then, so just so people have got an idea here, how many points of insertion are there with the Profhilo and the Structura?
So with the Profhilo, the original, there's 5 injection points each side, and this is a protocol that's provided by Profhilo. So, you know, we're marking up your face specific to you, specific for your anatomy, and following the protocol that's been provided by the manufacturers. So, again, if you're going anywhere and they're saying that it can be injected here, there and everywhere, that's not the case. You know, the protocols need to be followed. So 5 injection points each side of the face for the original one, and for the Structura it's just one injection point, but we use a cannula, so we are just depositing some product. Depends on your presentation as to which technique we would use. There's 2 different techniques that can be used. One that's better for people who are feeling that they're noticing sagging in their face, and then another one that's better for people that are noticing that sinking kind of feeling where they're losing the volume here. So yeah, depending on
so for us people are getting older, it's sinkers or saggers then?
Yeah. Yeah, exactly.
Going on from that then, how painful is it?
You know, it's a little bit uncomfortable. I wouldn't say, you know, it's not pain-free. We're injecting something into the skin.
I don't think anything that's been injected is pain-free.
No, exactly. So the original Profhilo, because it's pure hyaluronic acid, ultra pure, they don't mix anything with it. So they don't mix like local anaesthetic with it, which, you know, some fillers have local anaesthetic in, whereas this is ultra pure, so there's nothing mixed into it. So it does sting a little bit, and because of where it's injected, you know, it's injected superficially, so it does sting a little bit, but you know, by injecting it slowly we can help to kind of minimise that pain. And like I said, it's completely bearable. Like, you don't need any numbing cream or anything like that. It's over quite fast.
I suppose it depends on your pain threshold, doesn't it? Because I'm probably, don't laugh now, but you know, I'm the worst person in the world. I've got a really poor pain threshold. And obviously I still keep coming back for it. So
exactly.
Yeah, it is a bit uncomfortable, and it's not my most pleasant experience, but it's bearable.
Same beauty is pain.
Yeah, exactly.
No pain, no gain.
With the Structura, that's actually not as painful. Doesn't sting as much, but that's just because it's injected a bit deeper. And we also only have to break the skin once each side. So again, it still feels a little bit strange. It's a bit of a strange pull-in, push-in sensation, but it's not. It's not unbearable.
Okay, so one of the questions I've got here is, how long does the treatment take?
So the appointment is a half an hour appointment, but in that process we would do a consultation, and we're doing the skin prep and the marking up, etc. The actual treatment would probably take about 10 minutes or so. It's not, 10-15 minutes. It's not a very long,
quite a quick process.
Yeah, not a long procedure.
Okay, and another question I've got here is, after having it, can I go to the gym?
So we do recommend no vigorous exercise or extreme heat for 48 hours after your treatment, just because we want to minimise any risk of swelling, bruising, germs, any contamination touching the skin. So just, we don't want you sweating too profusely afterwards. So what I say is nothing that's going to make your face too hot and sweaty. A light walk and things is fine, but nothing too strenuous for 48 hours afterwards.
Okay, and going on to another question then. How does Profhilo work with, can I have other treatments? For example, can I have filler and Botox and lasers?
Yeah, absolutely. You can have all of those things with Profhilo because they're targeting different things and they're working on different layers of the skin, or they're targeting different areas, different concerns. But we would recommend waiting 2 weeks between appointments. So 2 weeks between your Profhilo appointment and any like lasers or facials, anything invasive.
I always recommend that as well. Yeah. Okay, so the last one I've got here is, and people often ask me this question, what if I stop having treatment? Will my skin return to how it was, or will I look worse?
No, absolutely not. I mean, Profhilo is a great example of this, I suppose, because with things like fillers, if you stop having them, you're almost, worst case scenario, it's just gonna dissolve and go back to how it was
I find that
previously.
Yeah, it just naturally dissolves by itself.
With Profhilo, because it's an active treatment and it's working under the skin, it's stimulating that collagen, elastin. Yeah, there's no way you're going to end up looking worse afterwards, because over that 6-month period of having that treatment, your skin will have naturally improved. So yeah, you're definitely not going to look any worse if you stop having it, but there's no pressure to carry on with it either. Give it a go and see how you feel. But I do find that most people, once they start, they like the results and it's something they want to keep up with.
Yeah, and I think, for me, I know if I go, I have mine every 6 months. But when I have that booster in 6 months, I know I've had it. It feels good.
Yeah.
The
other thing to mention as well is it's not just for the face, so you can treat the neck with it as well.
What would the benefit be of treating the neck then?
So when we lose that elasticity in the neck and we start to get that crepey skin, those lines on the neck, losing that kind of volume in the neck, it's really good to stimulate that regeneration in the neck. So.
Didn't you, quite a while ago, do Profhilo on the stomach?
Yeah, so they also have a body kit as well, which you can use in lots of different areas. There's quite a few things you can do with it, but really good results on the stomach with it. If you've got any loose skin on the stomach or stretch marks, that type of thing, it can be quite good for that. But that is slightly different. The pricing is a little bit different for that as well, because it's a much larger area. So.
Okay,
lovely.
Yeah, great. Well, I think that's kind of concluded everything.
I just wish I could do it on myself, because
because
I need it. I'm dying for a bit of Profhilo.
Well, I'm grateful I can get it done from you. So,
absolutely.
Yeah, great. Well, brilliant. I mean, anybody wants to know anything else about Profhilo, or if you feel we haven't answered all your questions, feel free to drop us a message.
Happy to answer anything.
Yeah, or come in. I mean, if you're unsure, you're thinking, maybe this is for me, maybe it's not. We always offer consultations, so you can just come in and have a chat with us at any time. But yeah, hope today's session was really helpful to you all. Thank you very much.
Thank you.